I just want to thank everyone for the opportunity for us to present our preliminary research. And I just want to thank everyone who tuned in to see more and learn more about our topic. So our topic is exploring the experiences of Latinas during postpartum, a phenomenological study. And it's by myself and 3 other researchers. So we'll take time to introduce ourselves quick. If I can push the next slide. Perfect. So me, I'm Ashley Brown. I'm the one talking right now. I'm currently in my 3rd year in the Masters of Arts Clinical Counseling program here at Alvernia University, and I am one of the researchers on this team.
And hi, my name is Dania. I'm one of the researchers as well. I'm a 3rd year graduate student, also at the clinical program at Alvernia University.
And I'm Jadziah. I'm the 3rd research member, and I'm also at the clinical counseling program at Alvernia. And Dr. Anthony Vajda is one of our professors, advisors, and principal investigator for this research study. And this kind of came about because of one of his assignments for our research class in last fall. And we chose this topic because it really resonated with us as Latinas, as women of color, as mothers, and just being in a community with like a densely populated Latinx community. So that's why we chose it, and we finally had the opportunity during the summer to actually conduct the research, and hopefully.
And it's still ongoing, so
Yeah.
hopefully we'll be able to finish it up in the next couple of weeks and the next couple of months.
So we're pretty excited to talk more about it.
Yes. Okay, so to start, there's not really agreed upon a time frame of postpartum period, but it can range from the 6 weeks to 18 months after birth. And with postpartum, we mostly think about like postpartum depression, and that's defined as depression that occurs after childbirth. And some of these symptoms may include, but aren't limited to, guilt, fear of being a good mother or harming the baby, loss of appetite, insomnia, uncontrollable crying for long periods of time, feeling disconnected with the baby, and really isolating yourself from others for more than 2 weeks. And these symptoms not only affect the mother, but it can also affect the development of the baby due to that strained relationship between the two. So 1 in 7 women develop postpartum depression, and that puts them at a greater risk to develop a major depressive disorder later on in life if it's gone unmanaged. And PPD can affect any woman regardless of age, socioeconomic status, race, ethnicity, level of education, and so on. However, women of color are at a higher risk for developing PPD, and that's because of the healthcare disparities and social factors they experience. And specifically, the risk factors that Latina women experience, they correlate with the prevalence of depression during and after birth, ranging from 23% to 51%, compared to the estimated 11% of the general population. And we'll talk more about those specific risk factors later on in the presentation. And this infographic just reiterates what I said about how 1 in 7 women experience postpartum depression symptoms, and that nearly 60% of mothers with prenatal and postnatal mood and anxiety disorder have symptoms, but they go undiagnosed, and that poor women and women of color are at a disproportionately more likely to receive care for postpartum depression. So this is another infographic that just explains some facts as to why women of color are twice as more likely to experience PMAD symptoms to external factors such as their culture and their perception of mental health, and just like seeking help overall, which may lead to their symptoms being underreported, and if they do seek care, it's not as equal to their white counterparts because of the covert and overt racism they experience within the system of the healthcare. And with access, it's also unequal because of stigmas, language barriers, financial stressors, and just the overall representation as well in the healthcare system. And this is why additional work is needed to help provide quality care for women of color. Okay, so why are we exploring the experiences of Latina mothers during postpartum specifically? So despite considerable amount of research attributing to identifying interventions that effectively support women through pregnancy and postpartum, still more than 80% of pregnancy-related deaths are deemed preventable. And women of color are 3 times more likely to be at risk for death and birthing complications because of the disparities they experience, as we said, within the society and healthcare setting. And so when we did this research, the CDC's National Pregnancy Mortality Surveillance System identified mental health conditions as the #1 leading cause of maternal death. And if we look at the surveillance's population for like the overall mortality rate, we would assume that Black women would have a higher mental health related death than Latino women because they make up the 2nd largest population in the group. However, Latino women actually make up the 2nd largest population to have a mental health related pregnancy death, only 2nd to white women who make up the majority of the population.
And then we'll go into the literature review. So when we initiated the research proposal, so where all of this started, we also had to collaborate and try to condense some of these factors into more manageable ones. So we decided to go with 3 overall that kind of helped encompass what we were trying to research and also get at. So some of those disparities that are within healthcare, some of those mental health problems and barriers, and then some of the marginalization and discrimination against women of color, but more specifically Latinx. So we narrowed all of the different factors that we had to these 3 to try to build from that. So we'll go into the first one. The first one is focused on marginalization and discrimination. Some of the factors that we considered for this research study were looking at cross-generational effects of discrimination and potential language-based discrimination within the healthcare providers for mothers. Some of those that we have on the screen that are highlighted are a study from 2009 that found a link between discrimination and healthcare. Now, a lot of the studies that we actually have are a little bit older. So within the last 15 to 20 years, there are very limited what we could find that were more current. So some of these are a little, I think to us, a little outdated, but still provided a good foundation for us to build on. Psychological response to discrimination by the mothers is sometimes perceived in high stress levels, leading to health risks on infants. Not specifically, it wasn't mentioned specifically whether it was during pregnancy or post-birth, but it's still one of those responses that may have some negative health-related issues to both the mother and the infant. And then some language-based discrimination include contextual and cultural factors, which include English language proficiency, and also native language and the accent that's tied with that. So we saw from different studies that this is what it was mostly focused on when it became language-based. One of the other things that I think we came across with some of our interviews so far is the lack of bilingual research, resource access in both the material that women are handed out, but then also the healthcare provider and staff. There is very limited bilingual staff that is able to provide more of that one-on-one connection that you have with your doctor when you go, to see them for an appointment. They may have interpreters, but often they are over the phone. It feels less connected. There's less of a human connection there. With marginalization and discrimination, some stereotypes in the literature examples that we found included statements such as Latinas have many children, or they have many children at a young age. This was from a study in 2018. Gendered racism was also discussed, labeling Latinas as promiscuous, sexually available. Some of these statements and some of these forms of discrimination, kind of put Latinas' bodies as stereotyped and they're being objectified. This was from a study originally in 1994, and then it was reevaluated in 2008. So why is this information important? Stereotypes can lead to discrimination against members of a stereotyped group, which has previously been reviewed through other research, having adverse health consequences, including sexual and reproductive health. And then the next factor that we wanted to include was some of those healthcare disparities. Some of the bullet points on the screen that you guys have here were some of the ones that I took out that just really stood out to me based on some of the information that we have so far from our participants in their interview and taking a closer look. So some of them include just the unavailability of having a healthcare provider to answer questions, or the unwillingness to dive deeper into questions they may have or concerns they may have. It seems like there's just not, they're either not available or they're not willing to go further into what someone may need. And from this same study, only 52% of Latinos reported feeling comfortable at a family planning clinic. So there is still much to be done to make some of these Latinas feel comfortable, even maybe voicing their concerns or asking for, a deeper dive into what their concerns are. Latinas share common themes, including Hispanic cultural heritage and social disadvantages that sometimes become part of this gender and minority status in the US. These differences and commonalities are important for understanding some of these health statuses, health behaviors, and healthcare experiences. So perhaps some of those cultural backgrounds are preventing them even seeking help. And maybe that is why we're only getting 52% of them feeling comfortable even approaching some of these topics. Some of the other bullet points there just highlight the rate of maternal mortality rate is 1.7 times higher. This was taken from 2007. So again, a little outdated. I think we would want to see some more updated statistics just again to see where we are. Next one. And then the last factor we wanted to consider was just overall mental health, but also taking a cultural component aspect into some of this research that we did. There has been a lack of research with Latinas in coming into motherhood, and little is known about specific sources of pregnancy anxiety in Latinas, including whether fears are rooted in cultural concerns or whether they're rooted in the disparities that they face, if they're here in the US or if they're in their native country. The results from a study done in 2022, so this was probably the most recent one that we could find, provides new directions that will be important to consider moving forward and how we can help some of this situation. And sometimes working through, some of those cultural barriers that include feeling lucky to be pregnant or believing that pregnancy is a blessing from God, putting others above yourself. There's a term that came across one of the studies that I wanted to make sure to include in the study, and that was Marianismo, which is the traditional female role of virtue, passivity, and prioritizing others over oneself, was inconsistently related to the risk of depression in pregnancy, but significantly and indirectly associated with postpartum depression. So this idealized, idea of motherhood in the Latino and Hispanic culture, putting more pressure on a mother, they're glorifying pregnancy, idealizing the duty of motherhood and what comes with that before putting ourselves can lead to some of that familial and cultural societal pressures of mothers battling emotions and even adjustment post-birth. So some of these terms we wanted to make sure to be included. And I think once we conduct some of the entire research and the entire study, we will be able to see if some of these components fit into some of our participants.
Thank you. So we really tried to anchor our research within these three theoretical concepts: critical race theory, minority stress theory, and relational cultural theory. So some of you may or may not be familiar with these theories, but just to give a really brief overview, critical race theory is used to pretty much acknowledge the experienced discrimination and disadvantages for minorities of other races. So specifically for this study, it would be exploring the discrimination and disadvantages for Latinas. Minority stress theory acknowledges the effects of social isolation and how it creates unique stressors for a minority group. So in regards to this study, for Latinas who may speak primarily Spanish, at times it can feel isolating to receive healthcare if you are unable to fully understand due to potential language barriers, which was a theme that some others did feel more comfortable if their healthcare provider was knowledgeable on their culture or was able to speak Spanish as well as English. And the last one's relational cultural theory. So that embodies the concept of mutuality and how impactful cultural factors can be when treating an individual of a specific race. Within the study, like I said, these findings are preliminary, but multiple participants mentioned that they would have felt more comfortable with providers who had that same cultural background and could fully understand what they were feeling during the postpartum experience and during their pregnancy as well. So with this study, there's a couple questions that we really were looking to seek answers from. So what we wanted to learn, what are the experiences of Latinas utilizing the healthcare system during postpartum? What are the main barriers to Latinas seeking services during postpartum? What are the mental health impacts of being a woman of color during postpartum? And how can the healthcare system best support Latinas during the postpartum period? These questions were developed to try and capture the essence of the lived experiences of Latina women during the postpartum period. So, how we were looking to get this research done. This is our methodology. So we decided it would be best fit if we use a phenomenological design. We chose that because, like I mentioned, we wanted to study the individualized experiences of Latinas during postpartum through connecting with the participants and learning specifically through their viewpoints. So that was done in the one-to-one interviews. We really took the time to learn specifically through their experiences, which was an honoring and humbling experience. We also used the use of snowball sampling. So with that, we advertised our survey on numerous social media platforms and through word of mouth. So with that, participants who participated, the snowball effect, of course, they would reach out to other people who may be interested in participating in the survey and doing the interviews. And that's kind of how we were able to get word around. We also directly reached out to various Latinx-based organizations in Pennsylvania to see if they were willing to either post or spread the word on our study that we were conducting. And luckily, we were pretty successful. We were able to reach Latino Connections, Lehigh Valley Hispanic Center, Doula My Way, which is located in Lancaster, PA, Berks Community Health, Hispanic Center of Berks Counseling, and a private practice counseling center, Aponte Chimiles Counseling. And all of them were able to successfully post their study, which was pretty cool and appreciated. So for our participants, we were looking for a sample size of 10 to 12 participants. This research is still preliminary, so while we haven't quite met the 10 to 12, we have been able to successfully interview 6 or 7 of the participants. And we were specifically looking for Latina women who have given birth in the state of Pennsylvania, are ages 25 to 35. And it might sound odd, but we did want to scan to make sure that that individual did not have a co-occurring mental illness. We felt it'd be best to exclude that to ensure that the results are directly related through mental health in regards to postpartum and any related issues with the healthcare providers at that time. As for data collection, so as far as the demographic questionnaire survey and the post, we had used a QR code and a link to a Culturix demographics questionnaire that was in both English and Spanish. So that was promoted on all flyers just to make that pretty accessible just to access the survey. We also use this questionnaire to screen for potential participants based on our criteria that was previously mentioned. So after these participants were screened, we reached out to the individuals who met the criteria, and we provided them by whichever contact information, whether it was email or phone, to try and set up an interview completely on their terms. So with the interviews, they were individual and semi-structured. So we had a couple guiding questions, but we allowed the participant to kind of take the reins on the interview and what direction we went in. So some of the questions were, how would you describe your relationship with your healthcare provider? Another one was, how do you think your culture has influenced your perception of pregnancy or parenthood? Some of our follow-up questions may have been, what had made the relationship good or bad? And how has your perception changed since pregnancy on those? We also, for each participant, we did require them to choose a pseudonym just to make sure that everything remained confidential and that interviews couldn't be tied back to the participant. And then for data analysis, we used open coding. And for that, we transcribed each interview and individually coded each transcription with themes that the individual had shared during the interview. And all overall themes that were expressed within that specific interview. Then we went to step 2 with consensus coding. So then we touched base with each other, us as the researchers, and we reviewed our individual coding and compared common themes that were discussed from each of our interviews. From there, we were able to identify even broader common themes with all of our interviews as a whole that seemed to keep coming up in reoccurring themes. So again, while not all interviews are completed through the coding or transcriptions, these findings still remain pretty consistent with our process for this preliminary research.
And so some of these common themes that Ashley just mentioned that we found in our preliminary findings were that the lack of resources provided. They often said that they weren't provided any resources, or it was mostly just for like the baby and not for them. So it was like no support group, no information about breastfeeding or CPR training or whatever they may have needed. And that kind of goes with the lack of psychoeducation and awareness for the mothers of what to expect after birth, what symptoms may be common with postpartum depression versus the baby blues, or what are symptoms of PMAD and what's normal, or what are the developmental stages that your baby should be following, or just this overall information that a first-time mother may need or be looking for. And that also goes into like, they had to conduct their own research. If they had such questions, they had to ask for that information, or they had to Google that information or seek out other people for that information rather than having it be provided to them from their primary, from their OB, from whomever they were seeing. And this kind of limited their human interaction, as they said that their first checkup was at the 6-week month after giving birth. So within that, it was just mainly, here it is, how are you, everything's okay. And with that mental health aspect of like the lack of psychoeducation, it was more just a form at the pediatrician appointment of, where are you, like what are your symptoms, how are you feeling? And it was just like, okay, this is your results. This is what you answered. And that's it. There's no follow-up. There's no anything else with that. And because of that, they really hesitated to ask for help because they weren't being provided information and they weren't being like having the follow-ups. So with that hesitancy, they didn't really know, like, is this what I am supposed to feel? Like, am I being dumb for thinking this? Like, is this a stupid question? Like, I don't want you to judge me. I don't want you to take my baby away. Like, because of their lack of knowledge, they were afraid to ask for help. And just the lack of quality care overall, with like their voices not being heard or having, breastfeeding pushed upon them if they wanted bottle fed, or like the main focus being on the baby with like 20 people in the delivering room and like no one's really paying attention to the mother. And it's overall just that lack of quality care that they needed or wanted. And so these are just some of the quotes directly from participants that support these themes. I didn't want to feel like a burden in anybody else's life asking for help, or even just like expressing how I felt because I didn't want to offend anybody because I was too scared to express what I was feeling. I just don't think she knew what she was doing. And then the Doppler thingy fell apart and she proceeded to say, "I'm sorry, the equipment here is shitty." And I feel like inner city hospitals are so busy that they lack the human connection. Like, let's just solve this issue, tell you what's gonna happen, and you just go, because we have so many more people to see, because there's just so many more people in the city, and we don't have time to provide individual care. They didn't tell me anything in terms of what I should expect. Well, I guess the basics, like you're gonna continue to bleed for so many days, maybe, and if it's this much, then you should come in and call. But I feel like it's very scripted. So as you can see with these quotes, you can see like the lack of resources that was provided, the hesitation to ask, the lack of quality care, even with the equipment, and just the limited human interaction of like, okay, you're just another client, you're just another patient. Like, we have so many moving on, like in and out. And so like with this, it really is just a very specific research that we're doing. And there are limitations that happen because the sample is so small and so specific, and the location is so specific with Latina mothers in PA. So we can't really generalize this to the overall population because of the specifics. And the type and amount of data that we're collecting, it influences how they experience and how the experiences will be categorized. So quantifying and conceptualizing their experience was a limitation because there are so many different ethnicities like within the Latinx community that hold varying cultural beliefs and values, and how an individual identifies will impact that data, as well as how far along they were in postpartum, like 6 weeks versus 3 months versus 1 year. Those are totally different experiences, And with this, another challenge is that getting all the participants to be available, to have our schedules align with their schedules, and have them be able to partake in an interview in a focus group and have time to code these interviews and everything, with external factors playing into like work, their availability, schools, and so on. So that's also a limitation that we found, and it's still a challenge that we're seeing with the limited participants. And so our overall expectation and implication for this research is to like hopefully highlight the disparities among the different populations within and outside of the healthcare setting. These differences are what increases the risk for birthing and postpartum complications for women of color. And so we really just want to bring awareness of the unequal treatment that may help identify interventions that can be implemented to help better support Latina women during and after their pregnancy. And maybe in the future, it might be beneficial for research to examine the experiences of women of color prior to becoming pregnant to help identify preventions and risk reducing methods for the development of depressive symptoms in potential mothers. So with that, are there any questions that we have? I know we kind of just zoomed through that. Let's check the chat.
Oh, thank you for the Giselle with the illustrations. Thanks.
Oh, thank you. Does anyone have any questions that we can answer or hopefully answer?
Okay, well, thank you. Thank you for your time. Thank you for taking the time to want to listen to our topic and about our research. We're really excited about this. While we haven't completed it yet, we're really excited to move forward with this and hopefully make a difference and kind of advocate for Latina mothers based off this study. So thank you. Thank you, guys.
Yeah. Oh, hold on. Oh, we got questions coming in. Was there any information in the literature review for Latina fathers?
No, not that, from what I gathered, no, there was nothing about a father figure or parent other than the mother. There was nothing about that. So I think that would be an interesting take as well. If someone does the research focusing on that, I didn't find any that specifically mentioned fathers. So I think that would be definitely one to consider, and there probably should be more out there.
Absolutely. Absolutely.
Our focus was more tailored towards the mothers, so we didn't actively seek out information about fathers or parents or the other parents. So that would be, again, just
a really interesting topic to explore.
And it could be more beneficial for this research as well, just to see just the overall parenting itself and how it's affected.
Any information about the effects of the importance? I don't think specifically about the effects of a supportive partner, but I think that would lead into, creating some of this change is putting more information out there of how maybe a partner can be supportive of, their partner or spouse going through some of those symptoms, and maybe even them learning to recognize where does it become, when does it start becoming more than just a hormonal issue. So I think that would be an interesting take. There's definitely a need for more psychoeducational information on all ends. The mother, the partner, and then overall the community. How can the family, what if they don't have a good family support system? How can the community as a whole just be more aware and be more accepting of some of these sometimes hard truths? One of the things that we mentioned about mental health with the cultural component is some of the stigma that may come from, your cultural background, your immediate support system of you're going through some of these things as a new mother, and everyone's, so happy for you. And it's this perceived idea that I have to be so happy, but I'm just not feeling that way. So how can we overall, as a community, just be more mindful and more aware of perhaps it's not, everything's great for the mother, although we want it to be, but it's not always the reality for a lot of people.
Yeah. And even though we didn't find anything in the literature review about the importance of supportive partner in I know from my interviews, our participants spoke on how their support system really helped them be it if they had like a hard labor or a hard birth, if they had like an emergency C-section or something, they all mentioned like they had a support system and that it helped them recover and be able to just be present and just get through their complications or the challenges they were facing, because they had people they could go to help. And I think it also like goes in with their culture aspect of that collectivism, like having the experiences of your other generations and like having that support of family, and how family is very important. So being able to rely on your other family members or friends or significant other, like that was also important to them.
Yeah, and I can even mention, so in 2 of my interviews, it was interesting because in the one interview, the woman talked about how she wouldn't have been able to get through the difficulty she went through while pregnant if it wasn't for her husband, and that her husband was the main support for her. And then it was also interesting because while support of the partners, one of the mothers had talked about how she didn't have the support of her mother because her mother went back to Costa Rica. And she kind of talked about how much she struggled because she didn't have that support, that motherly support from her mother while becoming a first-time mom. So those findings were also interesting to discuss in that interview.
One of my participants actually gave birth during COVID, and they wouldn't allow her partner or any family member to go to their appointments with them. And they said like that was really difficult for them, and they struggled with that because they didn't have support with them through this life-changing experience, essentially. So yeah, good question. Are there any
There's another.
I think it would be interesting to see how this changes for single Latina mothers and how they are affected. Absolutely, I agree.
Yeah.
Especially just talking about that support system.
Yeah, it's going through some of these things without that support system, without a partner who's there for you, who goes to your appointments, who's there at birth, who's there after. So that's where creating a better healthcare system for them is really essential, because that's all you have. You know, you have your doctor, and that's the person who's going through the process with you. That's someone that you can, turn to and say, this is how I'm feeling. If there is no support system available, we see that more with just a lot of things that happen, and divorce rates are up, and sometimes they go through this during a separation. So it's like, how can we support some of those single mothers who have to go through all of this, being a Latina, having a language barrier, having no support, not having access to the same equal care. There's a lot of different factors that go into it. So yes, finding some of these support systems is definitely important.
Yeah, and I think that goes with providing resources for them. If they don't have a partner, if they have distant family members and they don't have a support system, then having the resources for support groups, for first-time mothers, for single parents, everything that may be essential to have them be connected to others who are going through the same experience they are, and so they don't feel as alone as they may be.
And are you aware of any near future research with Brown and Black mothers on the subject? Yes. Dr. Vajda, who's couldn't unfortunately be with us today, he's the faculty who has been working with us on this research, and he is also heavily pushing for that. I do know, at least in my experience, when I was making posts on social media, I did have a lot of mothers, Brown and Black mothers, who were interested in sharing their story, and a lot of mothers who said, I have a story to tell, which was pretty cool to see. So following on the structure of our research, I feel like it would be fairly easy to just switch it and specify it specifically for Brown and Black mothers. I think the more research that can be done on women of color in general, the better, just because it's no secret that women of color tend to experience discrimination, especially in the healthcare system. I can speak on my own experiences and also experiences that I know of other women in my family and so on and so on. I think we all know of a woman who may have felt discriminated or maybe that her voice wasn't heard. So yes, yeah, very possible in the near future.
There is a wealth of literature regarding support systems during the perinatal period as protective factors for PPD. Positive multi-generational factors are also in the literature. Definitely, and that's why one of our implication was like to look before, like before the pregnancy, before birth, like what can be done to help prevent PPD or reduce the risk of developing PPD, PMAD, and all that. And it's interesting that it wasn't all just like negative experiences that we found. Yeah. Some of them had positive experiences, especially when I know one of my participants wanted to really talk about how she had a woman of color doctor really just support her and feel like her voice was heard, because the other doctors that she's seen was telling her that she would have to have like a C-section due to a health condition that was going on, that was on her leg. And the other doctor was like, no, as long as you're like okay and like you can safely deliver the child vaginally, then there's no, I don't see any problem with it. And the participant felt like because the other doctors were of white and they just were pushing for her to have that C-section because she felt a bit of bias towards her. And so she said, fortunately, she did have a woman of color and she felt supported and she felt heard and understood, and that she wanted to have that quote unquote natural birth without needing a C-section. So that was interesting.
And I think some of that, sorry, Ashley, some of that goes into just representation. She probably maybe felt a little bit more comfortable seeing someone who knew what her experiences were to a certain point, or if we talk about specific Latinx, having a doctor that speaks Spanish that's able to break it down for you in your own language, something that you understand, something that's not through an interpreter who's just throwing out medical terms that you still may not understand. I mean, at least for me personally, I go to the doctor, I'm like, please break it down for me. I don't understand these medical terms. Yeah. So even though it's great to have interpreters available, even if it's through the phone, they may not always, again, cater to what the mother may need as far as break this down for me because I still don't understand. So it's that part of representation and also making sure that information is available in both languages. And the more that we can tie human connection, which is where we saw some of the quotes, there's a lack thereof, again, through some of those resources and access to just overall something in their native language is something they can understand and feel comfortable.
And in addition, going off that, so off the question where it talks about regarding support systems and being able to advocate and have that voice and speak, one theme that really popped up was about doulas. And two of the participants that I talked to had talked about how crucial the support of a doula was and how that was what made their experience a positive one, because they had someone in their corner to break it down, provide that psychoeducation, and that person was also able to be there with them, not only with education, but also emotionally, and really be that advocate for someone who has never been through pregnancy or isn't sure what to expect, and can kind of help with those biases that some people may receive. The doula helps do that, and the doula pushes. So through that, I have to personally admit that I wasn't too knowledgeable on doulas, and we took the time to actually interview a bilingual doula from Lancaster, PA, and she was able to give a broad insight of what resources are available. So I think part of what needs to be done too is just figuring out what those resources are and how we can make them more accessible.
Definitely. One of my participants actually disclosed that she wished she had a midwife with her, that she wished she had someone tailored to her, focused on her needs, what she needed in that moment, what she needed to know, and to help advocate for herself, because she felt like they weren't listening to her and that all the focus was on the baby. And like, of course, that's important. We have to make sure the baby's healthy and that, nothing goes wrong. But at the same time, there's also a mother involved. There's also her feelings, what she's going through. And the participant stated that she wished that with the midwife, if she had one, like she wouldn't have felt so overwhelmed during the delivery room, that she would have had someone she could go to like whenever she needed like a question or whatever, because they were just focused on her. And like that's what the midwife is like supposed to do. Whereas with providers or doctors or whomever, like they have multiple people and they see you like once whenever, like at your designated appointment. And yeah, there's some like interaction, but it's like, okay, this is the appointment. Next, I have
Feels
another
very
one.
scripted.
Yeah, as they said. Whereas with the midwife, she stated like she would have felt more supported and understood throughout her entire pregnancy and after as well.
And that also builds on that lack of human connection theme that kept popping up. By having that, they could feel more connected as well. Because for anyone who is a mother, just because you're scheduled to give birth with a specific doctor, usually in that practice, you have to rotate doctors. So that also hinders that, relationship and humanistic perspective as well.
Definitely. Are there any more questions?
We could talk all day.
Apparently.
I don't see any more questions popping up. So again, we appreciate everyone taking the time to listen in. And, we're, like I said, we're still working on this, and we're excited to, at some point, share more information once we have all of our results and we're able to put all of these things a little bit more concisely.
Yes, this will be recorded. I'm unsure if it will be distributed to the general population. I think Katie can answer that for you, but it will be recorded. And we are also presenting at the Pennsylvania Counseling Association for this research topic.
November 4th.
Yes.
In Harrisburg.
So it will also be exactly what we presented, but hopefully with our findings and conclusion. Yes.
You're welcome.
It will be sent out to each of you. So as Katie said, the recordings to this.
All right. Oh, thank you guys.
Will we at least have access to all the PDFs for future use, because it's not on the website? Again, I'm unsure of that. Katie might be. I know we uploaded it to a file.
I'm almost positive Ingrid said that they're gonna send out slides and recordings to everyone.
Okay, awesome. Thank you.
Almost positive.
Thank you. Thank you. Yes, thank you, everyone. I hope
we appreciate it.
Yes, this was very informative, hopefully, and that you appreciate it. And
Everyone have a blessed day.
yes.